So welcome. This is our third installment of PLOS Mental Health, the bigger picture. And this is a quarterly seminar series that we've started in which we aim to highlight content in our journal, specifically content that has been authored by ECRs or authors from underrepresented communities, or the papers address issues that are specific to underrepresented communities. So today we're highlighting a recent paper in PLOS Mental Health from Gabe Hatch and colleagues across the US and Europe, which asks the question, essentially, can machines be therapists? And this, of course, is a very timely question and one that's always going to be quite divisive, and I think everyone has thoughts about. So we thought it would be beneficial to have an extended discussion on this. So I'm joined today by PLOS Mental Health section editors, Professor Christian Beste, who co-leads our Cognition and Mental Health section, and Professor Michael Breakspear, who co-leads our Underlying Mechanism section. And we'll be discussing some of the questions that this paper has left us with. And joining us in that discussion today is one of the authors of the paper, Dr. Laura Vowels, who is a relationship therapist and researcher at the University of Roehampton. So before we dive into this discussion, I'll hand over to Dr. Vowels, who will give a very brief summary of the paper and how it came about.
Thanks, Karli, for the introduction. So I actually joined this paper after I had a discussion with Gabe. I'd published something similar just before, kind of an earlier version of this, where I found essentially the same thing as what we found in this paper. And so then Gabe and I were kind of discussing the future of AI in therapeutic interventions and the ethics related to that. And he invited me to join in this paper. And what he wanted to do was actually get therapists, and he has a relatively large network of therapists in the US. So he wanted to get them to write answers to common therapeutic questions and vignettes to compare against ChatGPT. For example, in my paper, I just taken kind of excerpts from online that therapists had written. So the therapist didn't kind of have a say in how good and how much they would write. So in this one, we wanted to kind of make sure that the therapist had a fair chance in that sense. So we had therapists write, multiple different therapists write kind of responses to these questions, and then we were writing kind of the best answers, and these were then pitted against ChatGPT. And with ChatGPT, we did the same thing, so asked multiple times, and then put the best response forward to a panel of participants that then rated these kind of excerpts based on therapeutic skills, things like empathy, effectiveness, competence, cultural competence. And what we found in the paper was that most of the time, the responses written by ChatGPT were rated higher in these therapeutic skills compared to therapist responses, and they were more consistent with kind of common therapeutic factors than the therapist responses. And that was kind of something that we found across different papers in the past, and other authors have also found it, for example, for physicians, comparing physicians and ChatGPT or other AI. So this finding is relatively consistent.
So essentially, in this population used within the study and in other studies, the take home is ChatGPT is potentially just as good, if not in some respects, outperforms perhaps human therapists in some respects. So obviously this is a potentially divisive statement, even though it seems to be quite a repetitive finding. So I just wanted to hand over, because I know Christian and Michael have some questions off the back of this paper. Christian, did you want to go first?
Yeah, sure. Karli, thanks a lot. And yeah, congrats, Laura, to your really excellent paper. So I really enjoyed reading it, even though it falls a bit outside of my area of primary expertise. But nevertheless, I found it very telling and instructing. I mean, what Karli was already mentioning, okay, ChatGPT, or however you may call it, can do better than psychotherapists, and maybe my first provocative question in that regard would be, okay, how long do we need psychotherapists, and what are psychotherapists doing in the future if AI replace psychotherapists?
It's always the first question that I get, since my research is primarily on looking at essentially replacing the therapist.
Sure.
I mean, in the short term, I'm more looking at finding ways, excuse me, it's early, finding ways to augment the therapy or augment self-help interventions. For example, we have about 20,000 health and well-being apps on the App Store. Most of them aren't used because there is no therapeutic alliance. You use it once, you try it, and then you don't use it again. So chatbots can be, for example, we found that the therapeutic alliance with the chatbot is quite strong. So that might help with kind of self-help programs, people coming back to them, or waiting lists. For example, here in the UK, they can be 12 months easily to access therapy. So the chatbot could be something that is offered in the meantime. And then my guess is that some people won't need to go to the therapist afterwards because they already recover from having talked to the chatbots. But then people that do need the therapist could then go and see a therapist, and hopefully that could reduce the waiting times.
Yeah.
Or something that my clients often say is that they need a Laura in between sessions because they had an argument and then they have to wait a week before they see me again. And if they had kind of a Laura or a version of me in between sessions, they could potentially also recover quicker and resolve their issues quicker. So that's kind of in the short term what I'm looking into. I don't think any of us know what happens in the long term, how people really react to having an AI therapist, and how long does it take for humanity to kind of get on board, if you will. And also, we don't know really how well they work in the long term. Like, my research has only looked at individual sessions for now. And no one's really done ChatGPT over multiple sessions. So it's kind of remains to be seen. But I think in terms of psychotherapists and their future, I think they will move more towards supervising AI and kind of taking on cases that are more challenging for the AI, for example.
Right. So I completely get this point, and I do very much see a value in, widening the bottleneck to get to qualified psychotherapy, because this is, I mean, not only a problem in UK, it is a huge problem in Germany, and I guess everywhere else in the world. However, when we talk about this bridging function of AI-assisted psychotherapy, then the question is, how do you envision, for example, the entire process? Because at some point, the information or what the AI-assisted psychotherapy did needs to be handed over to the human psychotherapist. So they need to be really a line up in the caring procedure. And how do you envision this to happen?
I think there's different ways in which you can do it, or it can be done. For our research purposes, so far what we've done is we have people have those sessions, and then afterwards we kind of read the transcripts to make sure that there wasn't anything that was kind of dumb for the AI to say. And we also code for all those therapeutic skills to be able to improve the AI over time, obviously, so that there will be less things that it kind of gets quotes wrong. I think in kind of therapeutic settings, or when we've been kind of incorporating or starting to incorporate AI into some other interventions, then again, there is a supervisor for the chatbot, so that the supervisor can kind of read through. And we also have kind of AI supervising AI, in the sense that the AI supervisor will check for any kind of clinical risk and can flag it to the AI that's giving the therapy, as well as to us as researchers. So, for example, I get an email if a participant talks about suicide or something that's potentially higher risk. So then if you have, obviously it's not scalable to check through every single transcript if you have tens of thousands of users, but then you could be kind of receive an email for transcript where you need to go through and actually check it and potentially contact the patient. So that's kind of how we've done it. Obviously, there's very little that's being done at the moment in terms of like using chatbots in services as such. Of course, there are loads of kind of chatbots startup companies that are doing something to do with kind of chatbots and mental health, but you don't necessarily know how they're managing it. But that's kind of how I envision it to be.
What do you think about the following? So when you now say, well, there is AI-assisted psychotherapy, and you were talking about the transcripts and the importance of these transcripts for the handing over to the human psychotherapist, could it also be a chance, say, that you could seize this AI-assisted psychotherapy to get new boost on psychotherapeutic intervention research? Because, I mean, there are lots of researches going on. Okay, what are the necessary ingredients to have an effective psychotherapy? We also know, okay, well, when you are looking at different schools of psychotherapy, may it be cognitive behavioral intervention, may it be systemic therapy, even psychoanalysis. Or what you see is, okay, it is mostly the psychotherapeutic relation that is making a difference. So put it in more basic terms, okay, as long as there is somebody who is pretending to take care of you, it helps. So what do you think can we learn from ChatGPT assisted AI, and maybe also applying AI technology and all of the different transcripts you may have in the future in order to shape normal, in quotation marks, psychotherapy further?
I think the opportunities are pretty endless. Like something that we discuss with colleagues is, for example, with chatbots, you can tell the chatbot to stop being empathic, or you can tell the chatbot to just be problem solving, or you can tell the chatbot to do X, Y, and Z and not do something else, and it will follow that. Trying to tell a human therapist to not be empathic and guaranteed they will not be able to do that for very long. Or their non-verbals will kind of portray the empathy. So testing kind of and isolating specific aspects of the therapy that we, for example, in this paper, looked at as common factors, which we've accepted that are important for therapy. For AI, we can isolate those and we can see if having specific factors in the therapy process will actually lead to different outcomes, which we can't isolate in humans the same way. Of course, there are some complex interactions probably, so it may not look quite as simple as that, but in theory, those things are possible. I forgot your second part of the question, Christian.
No, I think this was already it. Thanks a lot. So maybe I can hand over to Michael for his questions.
Yeah, thank you, Christian. And as you said, this is a really thought-provoking and interesting paper, so congratulations. Yeah, I think this is more solid evidence in favor of what you might call AI augmented therapy. And I encourage people who are interested in this space to read the paper, because the discussion's also quite nuanced about the steps between a body of evidence like this and clinical therapy, and which you've just been discussing. I guess a few questions that come to my mind. First of all, a part of being a big part of therapy for many people is the notion of being heard. This shows that according to script and parameters, ChatGPT does a really good job. But in the wild, people will need to know whether there's a therapist and a human listening, particularly maybe not just for couples therapy, but for individual therapy, or whether, you know, they're interacting with a AI. And I wonder how much the I would imagine, and you might know more than me, Laura, about this, for many people, that notion of being heard and understood is a really big part of the therapeutic process. Um, and whereas for some people, um, being confronted with a clinician with all their foibles and maybe uh, people presenting with particular anxiety or other disorders, AI might do a wonderful job and even a better job. And we know, for example, people are often more honest, um, less honest with clinicians than with uh, online questionnaires, for example, about substance use. But I still feel for the majority of people, the notion of being heard is important. And I just wonder what your reflections are on and how do we deliver this sort of AI augmented care when people are knowingly not being heard by a human and just getting advice.
So we've now done 4 studies actually having participants interact with the AI and having a single session with the AI. And consistently, the participants feel heard and understood, and they feel like the chatbot was empathic and had their best interest at heart. So overall, people do feel that with an AI.
They were aware that they were interacting with an AI.
Yes.
Okay.
Yeah, whilst knowing they're
Interesting.
interacting with an AI. I have some colleagues in Zurich that are comparing AI and therapists, and I think they didn't tell participants who's who. I don't think that research is published yet, but I'm interested to know. I'm presenting at a conference with one of the authors in the summer. I'm curious to find out whether people could actually tell the difference between the AI and a human therapist in a text-based format. Our AI's voice, so you can of course tell that it's not. It's an AI because it sounds very good, but it doesn't sound completely human. But we do find in both this paper and in the paper that I published on this before this one, that people do have that bias against AI. So if they think that something is written by an AI, they do generally rate it lower than if they think something is written by a therapist. And usually when participants are in this study, if they thought that a chat GPT written response was written by a therapist, those were the responses rated the most highly. So we do have certain bias, so we might get people rate AI somewhat lower than humans if we compare them directly. But in terms of actually having a therapeutic intervention with an AI, our people consistently improve across various different outcomes. They rate the AI really high on therapeutic skills. The working alliance between the participant and the AI therapist is very high. So we do usually or generally find that it's well received and people like it.
It's fascinating. I mean, you see even in the social media, popular press, this sort of anthropomorphization of AI that it is become so convincingly human-like that people project things like, is it sentient? I mean, Jeff Hinton's touched on this. Sam Altman, the head of ChatGPT, said their latest version of ChatGPT had an uncanny human quality. And you can therefore not only see that the responses, I guess, as you've shown, are empathic and supportive, but maybe also come from some sentient source that many of us trained in the old school of psychodynamics would think is essential to the therapeutic process. So that's very interesting. I've cheated a little bit here because our group has done a little bit of research into large language models and the statistical structure. So when I read, I can it's not surprising to me the ChatGPT responses versus the human responses. So if you put the ChatGPT responses from your paper, which are in the appendix, into an AI detector, all of them come up with close to 100% this is written by an AI. You put the human responses in, then the AI detector says this is human written. I use one called Zero GPT. I don't know. I mean, so to me, the linguistic structure of the responses clearly belie a large language model. But I mean, I'm not a typical, I guess, at this stage, person using ChatGPT because we've done some research on it. But yeah, I still find it interesting that despite the fingerprints of the linguistic and semantic fingerprints of ChatGPT, that wasn't apparent in the way that it was assessed in this paper.
Yeah, I think the general population can't really tell. So I've done this with colleagues where I'm presenting and I'm actually giving examples from my other paper of therapist and ChatGPT kind of next to each other, or Llama next to each other. People who don't use ChatGPT daily can't tell the difference. People who use ChatGPT a lot can tell the difference because they're used to the language and the way in which ChatGPT talks. There are ways in which you can obviously make it sound more human anyway, but when we're not trying to massage it. So colleagues that use it find it actually quite amusing to kind of compare these. But yeah, it's the familiarity with AI that helps people to be able to tell the difference. But I mean, even like if we think about ELIZA from 1967, people couldn't tell a difference between an AI that was completely hard-coded responses and a human therapist. And that's kind of very rudimentary, wouldn't really call it AI compared to what it is today. So I think just a random Joe on the street probably won't have much of a chance of telling the difference. Certainly not if it's one. If obviously you train the person, so you give them enough of these and tell them that this is AI, they will start to pick up what is AI and get it right most of the time. And we've actually also, we're doing some research where somebody's coding human and AI therapist responses on this taxonomy. And he could most of the time tell the difference. And obviously over time he gets better, but there are still some structures and sentences where he couldn't tell that it was written by AI. So even though most of the time he can, it's not always the case.
Yeah, I mean, you can also ask AI to humanize its own output, and then it'll essentially put the Beste properties back in and be undetectable. And you didn't even need to do that in this paper, which I found really interesting. One of the issues that's frequently raised with generative AI, like large language models and also image production, is that they're very much biased by the homogeneous material that they're trained on, and this can amplify racial and cultural biases in the training data. And I was interested to see in your paper that you actually addressed that quite explicitly and found the responses to be, I don't know, and you might be able to obviously be able to better respond whether it was culturally nuanced or whether it just was culturally accommodating in the sense that ChatGPT acknowledged and created a grammatical context for cultural differences. Whereas a more nuanced response is that it might recognize different uses of language and other culturally specific norms. I just wonder what your reflections on that are.
So in the paper, we gave ChatGPT and the therapist specific vignette. So if we're saying it's an LGBTQ plus couple, it has the context. All AI models have and can produce text and information that is culturally sensitive and culturally competent. I say all, but like the major large language models, but you have to tell it to do that. It won't do it automatically. Like For a recent lecture that I gave, I asked it to produce a psychology professor from University of Roehampton. Of course, I got a relatively handsome young man. Not that. Okay, I'm just going to keep that to myself. But if I ask it to produce, let's say, a psychology professor of Indian descent, it will do that. It will still be a very beautiful woman, so then you have to further specify the parameters that you want. But you can get it to produce material that you want that is culturally appropriate. And it will, like, when we input specific information like LGBTQ, or this is, I don't know, African American couple or something, it can be sensitive to that, but it won't be as standard. So you have to give it that information. I mean, it's the same as you go to a therapist. If the therapist, you're just on the phone and you can't tell or don't know anything about the person, you can't adapt to that person until you know some information about them. So it's the same with the AI, for me anyway.
Yeah. That's all that comes to mind at the moment.
Thank you. I just want to finish off. I find this fascinating, and I'm not too shy to admit a lot of the discussion is over my head. So I wanted to finish off coming from the angle more of a client angle or a patient angle. I'm very much on the fence with AI in therapy. I can completely see the benefits. I think it's fascinating. But I also feel a bit nervous about it and cautious, and I know I'm not the only one. So I guess two very quick questions coming from a general client angle and touching on what Michael already asked, but I kind of want to hammer it home a little bit more. Do you feel there is a limitation for AI in terms of different mental health conditions, because different mental health conditions are of course going to need different therapeutic modalities, and some of those are very much centered around attachment, trauma therapy, attachment therapy, whereas other conditions that people will go to a psychotherapist or counselor for, it's more of a coaching. So do you think there is a limitation where perhaps there's a line drawn in terms of how beneficial AI is between, say, coaching and therapy? Do you think it's more suitable for that coaching need rather than that, say, attachment trauma therapy need?
Sure, it's a good question, Karli. At the moment, yes, it's better at kind of coaching. It's like in the sessions that we've done, it does quite well initially in kind of exploring and trying to understand the person's issue better. I use understand loosely as a term, obviously. And then it will kind of try to help the user come to their own kind of conclusion, but it doesn't do that consistently every time. Sometimes it starts to suggest solutions. So at the moment, with the current AI model, certainly that we're using, we don't know how well it would do over a longer period of time. But that's the AI today. AI 3 years ago, we couldn't do it. 2.5 years ago, we couldn't do it at all. Obviously, we used AI, but it was very much the kind of rule-based AI of you click an answer and you get the next question, you click the next answer, you get the next question. Not the AI that will do the therapy automated without you telling that much of what it needs to do. So what the AI is going to be like in 10 years' time, I have no reason to suggest that it couldn't do and be a competent psychotherapist, psychoanalytic psychotherapist that focuses on attachment, for example. Whether we really need the human there to build a secure attachment. I mean, I'm an emotionally focused therapist, so attachment is what I do, and that was what my PhD is on. But I have no doubt that it can in the future do it. And I think so in the study that we're actually coding the therapist-client interactions at the moment, it is using an attachment-based coding system and looking at which therapist has more kind of secure markers of being a secure therapist themselves. I may be mistaken, but I think the AI uses more secure markers than the human therapist. So if we make the assumption that if the therapist is more secure, they will be able to provide a safety and secure base for their client, then in the future, you would expect the AI to do better in a sense, because it doesn't go down these like, it doesn't have an avoidant attachment, for example, which would limit its capability of being there for their client, for example.
And the other question is, it's one that always comes to my mind when I'm thinking about AI in mental health, digital mental health. I have a general impression that older generations are already isolated, getting left behind in terms of help seeking with mental health, whether it's because of the mindset that they sometimes have, or the ways in which they can access information. How can we ensure that older generations, or just anyone in general who's not necessarily comfortable with technology, how can we ensure they're not left behind with developments like this?
Yeah, absolutely. And it's interesting that you asked that question, because that's something that we are very aware of, because obviously the younger generation generally find that they're much more open to using AI, the attitudes are much more positive. So we've done some research with older adults, and we have some older adults that are in kind of our patient and public involvement groups, looking at AI specifically, and actually they're very positive about the AI once they try it, and they really like it. And I think there is a real potential for kind of combating the loneliness that a lot of older people feel. And I have some colleagues that have done some research into like care robots, for example, back like 10 years ago for older adults. So they have a companion and they're not alone. And AI does quite well in kind of combating that feeling that you're alone and there's no one there, because it makes you feel like you're being listened to and heard. So I think there's a potential, but we're going to have to do a lot of work in terms of educating, in terms of going into these communities, going to, for example, in the UK, memory cafes or Age UK events, these sorts of things, and actually showing the people there what it looks like. And I mean, in general, most of the time, whenever I kind of show people Amanda and how she interacts, people like it a lot. Amanda is our chatbot. But if they don't have that interaction, the initial is like, oh my God, it can't possibly do it. Then they listen to Amanda and they're like, okay, actually, she sounds like a therapist. And that can help kind of break some of those barriers. But there's going to be a lot of work that we do need to do. But we have an older adults expert on our team that's very, very familiar with the population and has good relationships in the community. So we will be trying.
Okay. In the interest of time, we are going to have to wrap up there. We never managed to get these seminars within half an hour because it's so interesting and we could go on. Yeah, I think this is I'm so pleased that this paper's in PLOS Mental Health. I think it's so important because regardless of how someone feels about AI and mental health, I think we can't deny it. It's got fascinating potential. And even if it doesn't replace therapists, it's just a tool for therapists. We want it in the best shape possible for the safety of patients. So papers like this, I think, are just crucial to developing the field. So thank you so much, Laura, for joining us today. And also thank you to Michael and Christian as well. I'll link to the paper in the blog that's associated with this recording. And as Michael said, I highly recommend you read it because it's a really interesting paper. So thank you very much again and take care.